I'm doing my clinical presentation of a client. His chief complaint is that he reports feeling of palpitations, which started suddenly yesterday after school. His HPI consists of that the patient was brought to the clinic by mom and sister with concerns of racing heart. He reports feeling palpitations, which started suddenly yesterday after school. He reports a similar episode in the past, but states, "I didn't feel anything but when they caught it at the doctor's." He reports no chest pain, shortness of breath, dizziness, or lightheadedness. He reports drinking energy drinks, but with further questioning, it is actually Powerade with no caffeine. He reports sleeping fine, sometimes stays up late, but does state he is always tired. He reports eating a balanced diet, but does enjoy drinking Coke. He reports drinking 30 to 40 ounces of water daily. Mom reports that the patient had a stuffy nose and cough recently. So this was an abrupt onset. It happened one time starting yesterday, and it's not exacerbated by emotional or mental stress or physical exertion. His pertinent medical history is that he has had the recent cough and stuffy nose. He has no medications, no allergies. He denies extreme tiredness, fainting, shortness of breath with activity, nausea, dizziness, and flushing. His vitals consisted of blood pressure of 124/63, temp of 99, pulse of 103, respiration of 20, and O2 of 97 on room air. He is 6'1" and 170.4 pounds. Postnasal drainage was noted, along with tachycardia and infrequent skipped beats with physical assessment. He is also noted to be tall in stature, long fingers, and long arms noted. The patient is well and non-toxic appearing and not in acute distress. He is well nourished and well hydrated, alert and oriented ×3. He had no other noted abnormalities in his physical assessment, and he denies drug use, which was confirmed with a drug test, denies smoking, and does not have exposure to secondhand smoke. It was noted in his chart that he had previously been noted to have a benign and innocent heart murmur, and he has not traveled outside of the United States in the past 21 days. Labs and testing that were done, he had the plan to do an EKG, which will be completed today or completed that day, reviewed with the doctor. He will also have labs and a chest x-ray done, and then results will be discussed. He will also have a 14-day event monitor ordered to complete at home. So he got an EKG, chest x-ray, hemoglobin, A1C, lipid panel, magnesium, UA with microscopic culture, screen for drug abuse, bilirubin, complete blood count, comprehensive metabolic panel, TSH, vitamin D, iron and ferritin panel, mono test, and those showed, the EKG showed a sinus rhythm with slight ST elevation, but noted that it was a probable normal early repolarization pattern. His red blood cells did come back low at 4.5. RDW was 11.2. Neutrophils were 66.9. Lymphocytes 14.3. Monocytes 15.7, eosinophils 2.7, absolute monocytes 1.3, magnesium at 1.9, iron saturation at 13, total bilirubin at 3.4, direct bili at 0.8, cholesterol 108. His urine was noted to be orange with a +1 protein and trace blood, 3 to 5 red blood cells and a few bacteria, and many mucus. The chest x-ray findings showed an abnormal nodular opacity measuring 3 centimeters in the medial left hemothorax at the level of the AP window. The lungs were otherwise clear, no pneumothorax, and no pleural effusion. The impression was that there was an abnormal nodular opacity in the medial left hemothorax, and a chest CT with contrast was recommended. Some of the differential diagnoses prior to finding all that out was palpitations, unspecified tachycardia, hyperthyroidism, mononucleosis, Marfan's, iron deficiency anemia, untreated diabetes, electrolyte imbalances, or drug use. Plan was to follow up with a phone call or in person to discuss the results, and then depending on the results, consider an echo and referral to cardiology and genetics. And then obviously the chest CT was then needed as well. Unfortunately, he has not answered his phone to get those results, but he is due back for a clinic visit, and we are hoping to be in contact soon.